Welcome back to our Chapter 2 lecture. We are in week 2. I hope you all took a break for yourself, maybe stretched, did whatever you needed to do to kind of maintain your focus. We left off on opioids. So opium is considered to be the parent of all narcotic drugs. It contains 20 different drugs, the primary being morphine. Heroin's also a big one. It's highly addictive and can be used in various forms. So it could be used intravenously, meaning injecting like into your veins, snorting, or smoking. Methadone and buprenorphine can be used to treat addiction. So long-term efforts to recover from heroin addiction may include use of slower-acting opioids, such as methadone, to assist the heroin addict in harm reduction. So that's why you hear of like methadone clinics for those who are trying to get clean of opioids. Methadone is generally regarded as effective in harm reduction for opioids and heroin addiction treatment. Oxycontin is another one. It's this is a trade name for one synthetic opioid. So these kind of are downers, as you would say. The opposite being stimulants, which a stimulant can be tobacco. So tobacco addiction is associated with the deaths of 100 million people in the 20th century. So smoking is used by a lot of individuals. Nicotine. Sometimes people rationalize that chewing or smokeless tobacco might be less dangerous to one's health. However, that's not always true. These, smokeless tobaccos carry significant health risks for hypertension, coronary artery disease, oral cancer, oral lesions, and tumors. Caffeine is also a big one that I wanted to kind of bring up. It's not in the PowerPoint, but a lot of us consume caffeine. About 85% of children and adults in the United States consume caffeine, whether it's coffee or soda or energy drinks. In the DSM-5, the most current diagnostic statistical manual of mental health disorders, has a diagnosis for caffeine-related conditions, including caffeine intoxication, caffeine withdrawal, caffeine-induced disorders, such as sleep-related and anxiety disorders. So that's why a lot of times people say, if I don't drink coffee, I'll have a headache, or my weekend headache, because they don't have their coffee, and that's a sign of withdrawal. Your body becomes dependent on it, and so when you don't have it, there's a physical effect. Also, caffeine use disorder is included in DSM-5 Section 3, which indicates that more research is required to ascertain whether it's clinically significant a disorder, so more research is needed. Ephedrine, amphetamines, Ritalin, cocaine, these are all other types of stimulants. I want to talk about Ritalin and Concerta, which are drugs used a lot of times for ADHD. These can also be addicting. So as I mentioned in the first part of this lecture, when I worked at the crisis unit, we didn't prescribe any benzodiazepines, and that was merely because they tend to be addictive. Same with Ritalin and Concerta. They're actually an amphetamine and can provide a euphoric experience and enhance productivity. That's why kiddos with ADHD may have a prescription of Ritalin. Also, there's a myth that it improves work performance. So one time at the crisis unit, I came across someone who was in need of Concerta. He wanted it because he said that he had finals. He was a graduate student, and he thought that without it, he couldn't function. When in reality, instead of automatically improving physical and mental performance, stimulants sometimes just make people do poor work faster. So it's not this magical drug that's, going to get, make you do this A+ work or, improve your work performance. Definitely improves your ability maybe to focus, but it doesn't always mean that the quality of your work is going to be better. So ephedrine and amphetamines, amphetamine-like medications. Ancient Chinese medicine began using plants containing ephedrine over 5,000 years ago. More recent medical refinement resulted in extensive use in the United States after 1930 for problems mainly affecting the respiratory system. So there was a legal ban in 2004 due to these, these significant side effects. Amphetamines such as speed, methamphetamine can be, there's also various ways of using. So it could be orally, snorted, smoked, or injected. Like as talked about, it can be injected as a treatment to stop heroin addiction. Many of the negative side effects, such as agitation with severe anxiety, cardiovascular damage, paranoia, severe depression, drug-induced psychosis, and withdrawal-induced suicidal ideation, were also discovered. So there was a slogan in the 1970s that I'm sure a lot of you heard that said "Speed kills," because it is dangerous and leads to substantial brain damage. Non-pharmaceutical such as ice and cat. These are alternatives to pharmaceutical produced amphetamines, and they're illicit amphetamines. One example is a form of methamphetamine known as ice, like I stated. A more recent one is cat. Both cat and ice produce stimulant effects and have many of the same risks as the amphetamines. However, a lot of users go for these because they are at lower cost. There's many impurities because of the lower cost, though. The average is about $15 per gram. Combined with the relative ease of manufacturing the drug, illegal methamphetamine labs remain a significant concern in many communities. So they're cheap. Therefore, people who are addicted and desperate turn to these a lot of times. Talked about Ritalin and how it's prescribed for ADHD. Basically, its main action in the brain involves blocking dopamine reuptake, which results in behavior changes of improved concentration and tracking of information. There are side effects, as there are with a lot of other things. It includes weight and appetite loss, insomnia, nausea, hypertension, anemia. But there's new research that points to even bigger complications such as long-term complications such as liver damage, decreasing seizure threat thresholds, growth hormone disruption, visual hallucinations, cardiac arrhythmias, and things like that. So that's important to keep in mind. So cocaine is also classified as a stimulant. Crack cocaine can be smoked, and there was an epidemic in the late 1800s and early 1900s. Many stimulant abusers and addicts were seeking a safer alternative, actually, to amphetamines, hence the rise of cocaine use. Physical dependence, intolerance, and withdrawal can occur, so there's a strong potential for abuse. Addiction can develop quite rapidly within weeks to months. Those who are recovering. One time I was working with someone who was recovering from a cocaine addiction, and he described it as, the feeling of it overrides the need for anything: sleep, water, food, love, something like nothing else matters. So it really, really, really hijacks the brain. Cannabinoids, marijuana is one of them, which is controversial. Actually, one of the most is defined as possibly one of the most controversial illicit drugs. It's actually in a classified group all by itself because it's a unique substance. It acts like a stimulant, but other times it's similar to a depressant, and it resembles a mild psychedelic drug. So it is in its own classification because of these unique properties. It can be stimulant, depressant, mildly psychedelic, like I stated, but it also has negative side effects. So these include reduced lung capacity, estimated between 15% to 40%. Other concerns include lower testosterone levels, increased exercising pulse rates, upwards of 20%, and decreased muscle strength. So a lot of times, because now that it's legal, which there's more information about this in the book, people think it's all good and, it's good for you, but it's not always. There are medicinal uses, of course. But for purposes of this lecture, we'll just talk about the negative effects, such as brain changes, especially in short-term memory and executive functioning. The capacity to learn and focus attention can occur. But if you're interested in the legalization of marijuana and more information on that, it could be found in chapter 2 of this book. Hallucinogens and other psychedelics, such as LSD, PCP, ecstasy. So just kind of a breakdown of these. LSD alters the neurotransmitter serotonin, while PCP blocks major neurotransmission reuptake and disrupts neuroelectrical impulses. MDA, as most of us know it as ecstasy or Molly, this is the most popular psychedelic of the 1990s. It alters our perceptions. It's typically been associated as a party drug due to the effects of euphoria, empathy towards others. There's a sensory distortion felt for about 3 to 6 hours after the use, so your senses are heightened. You hear that people say everything just feels really good and you just want to be touched. And, many users seek Molly from the belief that it's free from addictive components and therefore it's safer. So there is a psychological dependency, not a physical dependency here, which is a very big difference from the other forms of substances that we've talked about. So it might be a psychological thing because, like I said, your senses are heightened and things feel really good and you're really euphoric. But physically, your body isn't dependent, can't get dependent on it. There are complications, though, from traumatic experiences, and emotions are noted as unpredictable responses to hallucinogens. So you might, as people say, might have a bad trip. You never know how your body's going to respond. Sometimes people freak out, or sometimes, they actually have a traumatic experience because they had a bad trip. So one time I was working with a mother who actually lost her daughter because her daughter had a party that her mom was supervising, but it was a birthday party, and her daughter had gone to the bathroom and they couldn't find the daughter for a long time. So finally they realized that the bathroom door was locked and she was knocking and calling the daughter's name and there was no answer. Finally, they had to break down the door, and it was a really big tragedy. I can't even imagine what this mom was going through, but there were a ton of water bottles next to the girl and she was unconscious, and she actually passed away. She used drugs, she used ecstasy, and her brain was telling her that she was really, really thirsty. Her reaction was that she felt really, really thirsty. She actually drowned herself from drinking so much water. So just because it is not physically dependent doesn't mean it's not, doesn't mean it's safe or safer. There's also the possibility of it being laced with something else. You don't know what's going into it. So kind of like you hear sometimes that people an experience that they thought that maybe their marijuana was laced with like LSD or something. Same thing with Molly. So another thing I want to talk about, it is not listed on this PowerPoint, but it's interesting, is something referred to as bath salts. So these are synthetic, and they were able to be sold legally in gas station, convenience stores. I've seen them at Walgreens before, and the internet. So users of these synthetic cathinones for their amphetamine-like properties, users also report psychedelic effects such as hallucinations, paranoia, and psychosis. So that's something that's really important to be aware of, is those bath salts. And here are some useful websites. Feel free to kind of explore these. My main recommendation, though, for I know you guys have a ton on your plate, so I know that you don't have a lot of time, but definitely review the NA website this week. It might be something, this might be one that you want to use for your reaction paper. And I have also added 3 different guides and charts that were displayed, well, 2 of which were displayed in the book, 1 separate. These are optional to view, but I do at least suggest saving them to a folder so that you can refer back to them in the future should you be interested in working with addiction. So there's also that. And also just continue to do the readings. I know I'm lecturing on one of our books, but there are a ton of other things that we need to read, so make sure you're keeping up on that. And I will see you in week 3.